So, hello everyone. Welcome to the ICFJ Global Health Crisis Reporting Forum. My name is Paul Adepoju, and I'm thrilled to welcome you to today's webinar on water insecurity during the pandemic and what it means for people living in poverty. And before we go right into the webinar, I'd like to inform you that whatever questions that you have regarding the topic of discussion today, if you are joining us on from Zoom today, please submit your questions on the Zoom chat, which you will find in the menu option below. And if you are watching from the Facebook live stream, please post your questions in the comments below the video. And on today's webinar, we'll be discussing water insecurity during the pandemic and what it means for people that are living in poverty. But I have a quick announcement for journalists and especially those that are members of our forum. And it's about our preparation as we build up towards the World Press Freedom Day. And so if you're a journalist living in any part of the world, we encourage you to kindly let us know what you are dealing with. Especially, we are asking two questions, which is for you to describe a challenge to press freedom that you or other journalists have faced and what needs to be done to improve press freedom. The second question we are also asking you is why do you think free press is important to your country and the world? So we invite you to send a 50-second video answering any of these questions to this email address, which is the email address that you are looking at on your screen. And this will be part of what we are going to be focusing on subsequently. But on today's webinar, our panelists are already ready, and we'll be looking at the water issues. Quick background: that globally, nearly 800 million people lack access to safe water, and nearly 1 million people die each year from diseases that could be prevented if families had access to safe water and sanitation. And this is according to water.org. And as we continue to face the COVID-19 pandemic, now more than ever, access to safe water is critical to the health of families around the world. But there is a major challenge, which is investment needed to solve the global problem. Water crisis is 3 times more than what is currently being applied. And in this webinar, Heather, who is the Senior Manager for Insights and Innovation at water.org, will talk about the challenges of the global water crisis and the implications to the health of people that are living in poverty. She's also going to cover the solutions that organizations like water.org are implementing to help meet the United Nations Sustainable Development Goal 6, which is clean water and sanitation for all. And for our journalists, you are also going to be learning how you can help to cover these issues. So on the panel today, we have Heather Arney, like I said. Heather, how are you doing today?
I'm doing well. Thank you, Paul. It's a pleasure to be here with you today.
Yeah, thank you for joining us. And we are also joined by Zara Shafir, who is the Senior Analyst Knowledge at water.org. Zara will be helping us out, will be joining us on the question and answer session. How are you doing today, Zara?
Doing well.
Yeah, so thank you very much. So before we take the questions and answers, we are going to have a brief presentation by Heather on this subject. Heather, I think your slides are ready. Are we ready to go?
We are ready, and Zara's gonna kick off the slides for us, and I'll join in a little bit on them.
Perfect. Okay, Paul and Heather, can you guys see the slides?
Oh yes, we can.
Perfect. Great. Good morning and good evening, everyone. Thanks so much for joining us. As Paul so wonderfully mentioned, Heather and I will be walking you all through what water insecurity means during the pandemic, especially for people living in poverty. We have a few slides set out for you guys today, and we'll be walking through those today.
Hey, Zara, sorry to interrupt, but we can see the notes. I don't know if you can zoom it in full screen.
Let me figure this out. Sorry about that. This is not doing it earlier.
Sometimes you have to share the other screen on your desktop. There it is. Perfect.
How about that? Perfect. Thanks, Heather. Okay, well, before I jump in, I wanted to introduce water.org. We're an international nonprofit that are dedicated to bringing safe water and sanitation through affordable financing. To date, we've reached more than 33 million people to get access in over 12 countries. And before we get into some of the stats and figures, I wanted to open up with a story that really ties the water crisis to the pandemic. Over and over in the past year, we've heard about the importance of washing our hands and of social distancing, but we wanted to highlight how difficult it is to practice these public health guidelines when you don't have safe water access at home. So in this photo that was taken around the middle of 2020 last year, you see women from the Balarampur village in India, and they're standing in these pre-marked circles that are distanced 2 meters apart, and they're waiting to fill their vessels with water. So a lack of access to safe water at home right now is more threatening than ever. Every day, these women leave their homes, they risk getting infected with COVID-19 and be able to get water from a public water source for their families every day. Thankfully, 2 of the women that are pictured in this photo today now have access to safe water at home, which empowers them to safeguard their families from COVID-19 and other issues. There's a lot more that we can be doing and a lot more that we can be helping these people get access to improved health, but it all starts with water. And just zooming in a little bit more on the water and sanitation crisis, nearly 1 in 9 people lack access to safe water at home, and nearly 1 in 3 people lack access to a toilet. In fact, there are more people that have a mobile phone than they have a toilet. Very quickly, I wanted to go over what we mean when we say access to safe water. So when we say access, this must be through an improved facility. So something like a piped household water connection, a public standpipe, rainwater collection, a protected spring, and the collection time should not exceed 30 minutes, including queuing. So this doesn't include household water connections. This includes more community water. And then how do we define access to a toilet? Access to a toilet really means, something that is connected to a sewer or a septic system. Maybe it's a pit latrine with a slab or a covered pit, or a pour flush latrine, and that should not be shared between households. So you can see here that the numbers are quite staggering globally: 1 in 9 without access to safe water, and 1 in 3 without access to a toilet. Next, we wanted to mention that water really is fundamental to solving many of the world's most urgent global challenges. It underpins so many of the issues we currently face. And on this slide, we wanted to outline a few of the issues that are touched by water. Access to safe water touches so many different aspects. We know that access to water and sanitation is the bedrock of good health. We also know that access to water and sanitation empowers women, and it also enables equality. Worldwide, women and girls are primarily responsible for collecting water, which forces them to spend valuable time away from school, their families, and other income-generating or restful activities. It increases access to education. Again, when these girls don't have to collect water or worry about where they're going to use the bathroom, they're able to go to school more regularly and stay in school for many more years. We've also seen that safe water and sanitation support sustainability. By having a long-term solution to their water and sanitation needs, households don't have to worry about continuously financing their water and sanitation solutions. They're not having to worry about where they're going to use the bathroom that day or where they're going to be able to get their clean water for the day. But also by sustainability, we mean that by having a sustainable flow of capital, these households can tap into the financing any day they need to enhance their improvements. And then finally, when you have a healthier family and you have more time because you're not looking for water or a place to go to the bathroom, you're able to participate more in income generating activities. We've seen instances where people are using the time savings from water collection to be able to participate in the workforce. And also in certain situations, we've seen that people that used to pay for water now have a savings due to a household connection. And that also increases some of the savings at home. Now, tying the water crisis to a health crisis a little bit more deeply, I did want to share that nearly 1 million people die every year from water, sanitation, and hygiene-related diseases. Examples of these diseases include cholera, diarrhea, Hep A, polio. Access to safe water and sanitation contributes to the improved health and helps prevent the spread of infectious diseases. This means reduced child and maternal mortality rates. This also means a reduced physical injury from the constant lifting and carrying heavy loads of water. A typical jerry can holds 5 gallons of water, which amounts up to 40 pounds. So you can feel how carrying 40 pounds back and forth, sometimes a distance of 30 minutes or more, how that can really wear on someone's body. So not having to do that really leads to improved health conditions. I also wanted to share how the water crisis is a women's health crisis. So globally, women and children spend 200 million hours collectively collecting water. So this is time away from school, this is time spent away from work, caring for family members, even just playing and resting. The average woman in Africa and Asia walks about 3.7 miles to collect water. So you can see that takes a very large chunk out of their day. Additionally, women and girls spend about 266 million hours every day finding a place to use the bathroom. So you can see that women and girls especially are disproportionately affected by the water crisis. Women and girls spend large amounts of time carrying these heavy vessels and walking long distances. When they have improved water, sanitation, and health access at home or closer to home, this leads to improved health for the women and girls. It reduces disease, undernutrition, injury from water collection, and stress. There have also been findings that access to improved sanitation leads to a reduction in assault and violence on women and girls. Again, bringing children to the forefront, the water crisis is the children's crisis. Unfortunately, every 2 minutes, a child dies from a water-related disease. Diarrheal disease is the 3rd leading cause of death in children under age 5. So with safe drinking water, this means children don't have to experience these waterborne illnesses like diarrhea or typhoid. And whether they're consuming contaminated water or suffering from dehydration due to diarrhea, a lack of access to safe water is the primary reason and is responsible for these deaths. So now more than ever, safe water has the power to protect and save lives. 3 billion people around the world, so 2 in 5, don't have access to soap and water to wash their hands at home. As we know, water has taken a central role in the world as we face the epidemic. We were told that the first line of defense is to wash our hands and to stay home, but neither of those is possible without access to safe water at home. We know more than 2 billion people lack access to safe water and sanitation at home, which makes the issue of water access more urgent and important than ever. The truth is that access to safe water at home protects and saves lives. It's critical to the health of families all across the globe. Like Paul mentioned, our work is uniquely tied to SDG 6, which ensures the availability and sustainable water management. Ensure availability and sustainable management of water and sanitation for all. And that's the main goal that Water.org has really rallied itself around. The main challenge that we've noticed in achieving SDG 6 is the access to affordable financing. The World Bank has estimated that it would take $114 billion a year for safely managed access to water. So at current levels, that means countries need 3 times more the current annual global investment to ensure long-term safe water and sanitation access. Currently, millions of families spend time and money collecting water and paying very high prices to vendors for temporary access. And for millions of people around the world, the access to the funds stands between them and the safe water. So at Water.org, we're trying to tackle this very problem. We help people in need get access to small affordable loans for water and sanitation solutions. We're committed to helping remove the financial barriers and getting taps and toilets at home. The access to affordable loans for safe water puts the solutions into the hands of people in poverty. And with that, I'd like to hand it off to Heather.
Great, thank you, Zara. So transitioning more over into our work, we are water.org. We're breaking down barriers between people and access to safe water and sanitation. We're an international nonprofit organization that's positively transformed more than 33 million lives around the world. Founded by Gary White and Matt Damon, Water.org pioneers market-driven financial solutions to the global water crisis. For 30 years, we've been providing women hope, children health, and families a future. We're active in 13 countries and we work with 154 partners. The types of partners that we work with include local financial institutions, service providers like utilities, and government entities. Next slide, please. Our approach is proven and powerful. We solve smart. The best way to help people get access to safe water is to help them get access to small, affordable loans made possible through something that we call water credit. We solve together when we put the power into the hands of the people who need it the most. The solution is more likely to succeed and to last. We solve for the system. We address both the symptom and the cause, solve for the immediate need by creating access to safe water and sanitation now. And we solve for the big picture by setting up a system that works at scale and lives long after we do. Next slide. So as Zara mentioned, there just isn't enough money to meet the universal access to meet the needs for everyone for access to safe water and sanitation. Through approaches like water credit, microfinance institutions can mobilize capital from the commercial market to provide their clients affordable loans for water and sanitation improvements. As clients repay the loans over time, the institutions recycle those repayments into new loans, reaching more and more households. Since the start of water credit, financial institutions have mobilized more than $2.6 billion in capital for more than 7.2 million water and sanitation loans. The way that water credit works is that we partner with local organizations, primarily microfinance institutions, to develop, pilot, and scale small, affordable loans to those who need it. Low-income households take out a loan from a financial institution of around $300 and hire local contractors to construct the water or sanitation improvement. In addition to the loan capital for the improvement, our partners conduct activities like market research. They spend time and design affordable water and sanitation loans that meet the local needs and conditions. And they conduct community education around hygiene, water, and sanitation related diseases. Next slide. Over the years, we've developed an evidence base for water credit. By 2014, we had proven the concept and started to see several financial institutions scaling water and sanitation lending. At this point, we demonstrated that there was a latent demand for water and sanitation loans, and that people living in poverty were willing and able to take out these loans and repay them. We found that water credit benefited financial institutions from both a business and social mission perspectives that help get people out of poverty. We found that it benefited donor efforts by maximizing their limited dollars, and most importantly, it benefited children, women, and men by meeting their water and sanitation needs. By 2016, water credit programs were operational in 13 countries and have grown in number within each country. As we see here, the impact has accelerated, particularly over the past 3 to 4 years. Water credit has proven to be able to reach low-income households. We know from our rigorous monitoring and evaluation methods that 87% of water credit borrowers are female, that 89% live under $6 per day, and that the repayment rates on the loans are 99%. Through third-party household monitoring visits, we have found that more than 93% of those loans resulted in complete and functioning water and sanitation improvements. While we have seen great success with this model, we also recognize it's not a silver bullet and that the poor are not equally poor. Our work targets low-income households, which are millions of households that can't pay the upfront cost of a $300 water connection, but can make small payments in that amount over time. This is our niche in the space, whereas government programs and other important sector organizations focus on the ultra poor and other areas that we don't cover. The size of the global water and sanitation crisis is too big for anyone to solve. It takes a global village, like all of us working together to end the global water and sanitation crisis. So we appreciate you as journalists to help people become more aware of the issues and ways to recognize more aware of the issues and ways organizations are working to solve it. Okay, next slide. So as we wrap up the presentation, I wanted to leave you with Sofan's story about giving her baby a healthy start. For Sofan here, there was nothing beautiful about the water-related burdens she endured much of her life in rural Cambodia. She wanted to end those burdens for her son. It is women like Sofan who inspires to give their babies a healthy start to a beautiful life that we created Water Credit. With a small, affordable loan, Sofan and her husband were able to pay for the construction of a rain storage tank and water tap on their property. What was once an unsafe to consume and took hours to collect is now available right outside their door. So thank you for joining us today and learning more about water and sanitation. Here are some helpful resources from our website and third parties that we wanted to leave you with. From this presentation, you'll be able to access and link to these sources.
Yes, so thank you very much for the presentations. And before I open the floor for questions, I think I also have quite a lot for both of you. Now, prior to COVID-19, what do you consider to be a major challenge in water-related issues, and how has this prioritization been influenced by the pandemic? So let's start from there.
Yeah, great question, Paul. So prior to the pandemic, we've really identified it's a financing issue. It's getting affordable financing to those that need it the most, and that has been the number one barrier. So as we saw through the water credit example, there's millions of households out there that are able to repay like microfinance loans. So while they don't have $200, $300 up front to get a water connection or a rain roof harvesting system or a toilet in their home, they are able to make small payments over time. And it's, as Zara pointed out with that one slide, the gap is startling of how much financing is needing to solve this problem. And so being able to find smart solutions that go on and work past any organization like us, people are able to just keep borrowing and repay those loans and borrow again. And so just really recycling that money to be able to accelerate the reach for so many to get those water and sanitation improvements.
Then if you look at the pandemic and looking at the extra burden, financial burden that it has had on families, I think I'd like to bring Zara here regarding how ideas like water credit, who do you think would be willing in LMICs to be able to take on additional loans to be paid instrumentally? So what I'm trying to say is that, do the people consider water crisis huge enough for them to consider taking on water credit to solve this problem?
That is an excellent question, Paul. And yes, we have noticed that even before the pandemic, a lot of the clients of these microfinance organizations that we work with, they had a very large demand for financing for water and sanitation improvement. And I did want to be very clear that the segment of the population that we do focus on is not what we would consider the ultra poor or those households that really cannot afford to take out a loan or make those payments. Traditional philanthropic models are more suited to address those needs. But really, we're focusing on that population within the bottom of the economic pyramid that does have some savings or some leftover income at the end of their month that they're able to make those monthly repayments. without being a burden on their households. The only thing, again, like Heather said, that was standing in their way between their households having that safe water and sanitation access and not is the availability of that capital, not having that $300 in their pocket right then and there. They just needed someone to make that available to them. And so they are able to make those payments. We have seen that even during the pandemic, our rates of lending they slowed down slightly because of lockdowns, but they are rebounding right now. So we're seeing that the demand is still there.
Okay, but if demand is still there, let's go back to water issues reporting. Personally, what do you think journalists are getting wrong regarding water media coverage?
What do I think journalists are getting wrong? That's a good question. I think a lot of times it might just be like understanding maybe the local environment, because it's really dependent on what's happening. So sometimes there may be enough water. It's just the way that water is being managed and how it's being distributed. We often see times where there's not enough water in the systems, but the way that it's being shared across the different households and the different users can look very different. Sometimes they don't have water 24 hours a day, 7 days a week, and it's being distributed to try to manage and save the water. But then on the other hand, there's people that are and utilities are just wasting water. And so I think it really comes back, especially with climate and how climate is changing and really impacting availability of water, just coming back to the local issues. And so being able to understand from the local issues what's happening, but then also taking it from a global approach as well.
Sarah, what do you think?
I agree with Heather. I think the local context should be taken into consideration. I also think a lot of times journalists are focused on, the water and sanitation crisis as a whole, but I think we're not looking at the right solutions. I think a lot of the public's mindset still is focused on that philanthropic model of going out into the community and building a well, or, kind of giving out these solutions. And we've seen through a lot of the research that a lot of those solutions that may have been put out into those communities, after a few years, they're no longer used because they're not maintained. Community maybe didn't see a need for them in the first place. So I think there should be a shift in focus towards more sustainable solutions. And I think financing is one of those sustainable solutions that we should be bringing more attention towards. I know larger organizations like the World Bank, they have started focusing more on the blended finance solution. And I think maybe shifting the public's perception of how we address the global water crisis should also start tracking in that direction.
Then how has the pandemic influenced water issues, especially as the efforts towards dealing with pandemic accelerated reaching the targets for water-related issues? What kind of influence are we talking about so far?
Yeah, I mean, the pandemic definitely has influenced the way that we think about our work and the way that others think about water and sanitation as well. As Sarah showed in that first picture of just women having to queue in lines with the circle to get the social distancing, but just as this picture here shows, hand washing, so critical as a defense against diseases like COVID. And we quickly pivoted to put a bit more of a focus on hand washing loans as well. And some of our partner organizations started seeing a larger demand for water for hand washing facilities, for people not having to share toilets and things like that, so they can feel safer and be more isolated and quarantined and things like that. And they've made changes too. They pivoted for example, there's one organization in India that we work with that had a policy that any water sanitation borrower had to be an existing client, that they had to have a credit history with that organization. But because of the pandemic, they took away that criteria, and we're letting people get loans for water and sanitation, even if they were a new client without that existing credit history with them.
Zara, do you want to add anything to what Etha just said?
No, I think she covered it pretty well. I think we've seen that there has been an increase in people's awareness of how safe water and sanitation impacts their life. Again, like we mentioned, the public health experts have really drilled into our heads that we need to wash our hands, we need to stay safe distances apart. And like we saw in the picture, it's really impossible to do that when you're sharing your access to water and sanitation with other households, and when you just don't have a household water connection to be able to wash your hands. So I think that also accelerated in the borrower's mind the importance of having this household access.
Now, let's say a journalist wants to really cover, let's say, water problems that are in relation with poverty. We know the stereotypes, we know the conventional ideas that comes to mind. You talk about, okay, these people are, we can say people are really too poor for them to be able to afford potable water. And are these baseline, let's just say these null hypotheses, are they always valid, or are there exceptional cases in which poverty has not really influenced people's perception about safe water?
Yeah, I mean, one way to answer that question is I think that people underestimate the poor, and that the poor are not equally poor. We know from the experience with water credit that there's millions of households that are living in poverty that are willing to take up water and sanitation loans, and they're able to repay those loans. And a lot of that is because they're already paying either through time or money or other sacrifices to get that water and sanitation. And one thing that has struck me about the model like water credit is that they're actually making their own choices about, this is the type of water or sanitation facility that I need. It's not a donor telling me I need this. It's not the government telling me I need this. This is what I know I need for my household. And because of that, and because you're really empowering by giving people to make the best choices that meets the most, makes the most sense for their individual household. So I think that's a shift in a lot of the maybe traditional development thinking, by putting really the households in the driver's seat and being able to make the decisions. And because of the way that the loan terms are set up with market interest rates, or sometimes below market interest rates, depending on the situation, and having the payments spread out over a long time, we are able to see a really high repayment rate, like that 99%. That really signals that people are able to repay these loans.
Oh, really? I think sometime last year, I was writing a story on, let's say, the end of open defecation in some countries. And I think Nigeria, India, prior to the pandemic, was at the forefront of dealing with his water issues. And some of the propositions that many countries have been advised to do is to make water access available to people, especially in the public places, and to build toilets. Do you think this water credit approach is more effective than building toilets and improving access to water for free to the general public?
I mean, I do, I do think that is having it available free to the public could be a step in the right direction. I mean, it's definitely going to be a multifaceted approach to solve the water and sanitation crisis. That said, if people can have a choice to have water that they have to go somewhere and collect, or versus at their household or at a toilet that's theirs, that they own, that they don't have to share with a bunch of other people, people should have that right, and so figuring out how to enable that, I think is very critical, and that's that the part of the pyramid that the Zara was talking about, those millions and millions of households that can afford this solution. It works for them. For the ultra poor, solutions like you're just saying may be the best solution for now, and hopefully a stepping ladder up, as the ladder goes up and up to having safe, clean water at your household and a safe, clean toilet at your household is ultimately where we want everybody to be.
Zara, so what do you think?
Yeah, I just wanted to add on to what Heather was saying. You're right that a lot of those governments did have government initiatives to build out public water and sanitation access points. What we don't really know what will happen in the future, or some research has suggested that a lot of those times, those publicly developed access points sometimes fall out of use because of maintenance. A lot of times maintenance is kept up. So, the toilets might be non-functional at some point. Also hygiene issues. If they're not kept clean, people are not going to want to use them. So you could have a public, toilet structure that's open to the community, but then the question boils down to, does the community want to use it? Is it functioning? Is it clean? Is it somewhere they're going to want to go and feel like they're safe using that facility? And same goes for water. I mean, the water, who knows if water quality is being monitored. And also a lot of times water availability is an issue. So if it's not continuously available water, again, that area of access may not be continued to use in the future.
Now, if you look at the goal 6, which is to ensure access to water and sanitation for all, and how do you think that can actually be achieved anytime soon, considering the various aspects of issues that individual country is dealing with, peculiar challenges, threats to previous plans by the pandemic, and which has required several countries, governments, and agencies to reprioritize. Do you think the pandemic can really have any effect or any impact towards achieving the goal of ensuring that everyone, irrespective of where you are, you can actually access good water and sanitation? Let's start with Zara.
Yeah, I actually do think that the pandemic even has put water and sanitation at the forefront. Like we mentioned in the slides, safe water and sanitation access is really the bedrock, the foundation of having good health. And I think a lot of governments and organizations see that, without safe water, without safe sanitation, you're going to continue having those infectious diseases go round and round in circles in your community and in your populations. And once you're able to bring safe water solutions and safe sanitation solutions, you're able to cut that infection transmission route. And even with COVID, you see that, we're washing our hands, we're trying to stay safe. If you have a household connection, you're able to stay away from others that may be carrying the infection symptomatically or asymptomatically. So I think you can see that water and sanitation really is, a foundation of a lot of the issues, the health issues that we do see globally. Heather, anything?
Yeah, that's well said, Zara. I mean, maybe I would just add that I think it does put that spotlight on public health, and without safe water and sanitation, you can't have healthy communities. And so I think it's, we might be seeing a little bit of a dip as everybody needs to refocus resources on the pandemic. But water and sanitation is a part of the pandemic. It's one of the defenses, against the pandemic. And so, even though we might be seeing a little bit of that dip, I think it's going to accelerate the focus and the attention on water and sanitation as we continue to rebound from it. We have seen through our programs a resiliency with our partners, with the households, and even they're having to make harder choices than ever right now, but they're still making choices to lend for water and sanitation, and the households are making choices to get loans for water and sanitation. Even though it's a difficult time, they see this as more important now than ever.
So as a journalist, one of the problems that I actually personally face, and from the questions that we've been seeing from the various platforms, is also consistent with what journalists from different parts of the world are struggling with, is getting data sources for their story. I'll start with a question that Abdullah Mohammed is asking. Mohammed is asking that I need data sources for water crisis in MENA region. According to Mohammed, it's hard to get updated data about this region. Can you help? And so I think this question is really, really consistent, especially with this region. So let's look at Mohammed's question as a second part of a bigger problem. The first problem that I would like you to address is this. How do you track water sources from different parts of the world? Which parts of the world are data readily available? And for these other parts of the world that are struggling, what data sources do you think journalists can still be making use of tentatively?
Perfect. I'll take that question. So we do have a few of the third-party resources listed here on this slide, and I think Paul will be sharing out maybe some of these links after the webinar. But I would point all the journalists towards the Joint Monitoring Program's website. So the Joint Monitoring Program is really the leader in water and sanitation data. It's a program that's co-led by the World Health Organization and by UNICEF. And nearly all of the water organizations, they receive their data from the Joint Monitoring Program. So that is the gold standard of data. They do have it broken out by regions and by specific countries. And what they do is they collect data from the government surveys. I think they also have their own surveyors that go and do data collection. And I believe they update their data every 3 to 5 years. So I think perhaps the latest data that's on that website is from 2017, but they're continuously updating. So for water.org and the Insights and Innovations team, which is the team that Heather and I are on, this is our go-to source for having the most up-to-date, the most valid stats and figures available for any country that we're able to find on that database. So I would say that's your first spot to start looking. These additional resources that we have, IRC WASH is a really excellent resource. We work with them a lot, and also we refer to their data. And then again, just the World Health Organization, the UNICEF, those are really excellent places to be able to find data.
Well, I still believe that while these data sources can give us ideas about the global, continental, and to some extent national status of water crises, do you think, what do you think a journalist that really wants to do a local story on water crisis can do, especially in regions where this data per county is not available? So what do you think they can do in going about gathering data that will be relevant for their story from the local point of view?
Yeah, I mean, that's a good question. So you definitely could start with like the Joint Monitoring Program from that higher level and get that country level data. But then from that local perspective, you know, I guess it depends where you are and what you can do. So like it doesn't take much to go out and find people that don't have water and sanitation, and just asking them about, where do you collect water? Where do you go to the toilet? It's kind of a snowball method or something of that approach could work. But we often work with like the local community leaders. So like, especially in rural areas, talking with, the mayors of the towns, or just a lot of like women's self-help groups, community people that are actively involved in the community, because they know best about their water and sanitation. They know where they can access it. They know the challenges, they know the solutions. And so just going out and talking to the community, and sort of, getting things as local as you can, but then also using, the third-party data to help fill out anything in between. If you're lucky, being able to talk to the ministries as well, like that might be more at, getting into the district or state level, and even national level ministries to understand, like, how are they budgeting for water and sanitation? Like what portion of your budget and resources are you, giving for water and sanitation. There's a program called FinTrack that is trying to help understand the financing for water and sanitation from all the different perspectives. So the perspective that we presented today is one that's using market-based approaches, but there's also the public financing. There's other types of financing that all comes into the picture for being able to fund water and sanitation. I hope that answers your question, but basically there's so many different angles that can be used from the local to the national to the global to help stitch the story together.
Yeah, thank you. So we have quite a lot of questions already, and I have a lot for you personally, but I think let's quickly get the questions of the participants out. So I think this is a very short question. Can you share the name of the organizations in India you work with? Are there water.org partners in India that journalists in India can actually reach out to when they're doing water-related stories?
Oh yeah, is this something that we can give you after the call, because there's quite a number of institutions that we work with now in India, and I can't recall if we have a public listing of it or not, but is this something we can give you, Paul, after?
Of course. You can share
Okay.
that information with me, and I'll escalate it to the people that really had asked the question. Then,
okay.
So we have a question from Izina Niwe. Izina is asking, good afternoon and thank you for the opportunity. I noticed that Nigeria is not one of the countries Water.org works with. So please, is there a reason for this, and whether there are plans for Nigeria in the future?
Yeah, it's a good. We would love to work with Nigeria. It's something that we've talked about for many years now. It comes down to resources. We have to have a minimum amount of resources to be able to activate in a new country. But it has been one of the because of the water sanitation situation in Nigeria, and us seeing opportunities in where Water.org could add value. It's been on a high part of our list. It just comes down to resources. So unfortunately, we don't work there now, but we do hope so to be in the future.
So Dawood Olatunji is asking whether they'll be able to access the slides. Yes, they shared the slides with me, and I'm going to put it up in the forum. For Asif Mohammed is asking, since COVID-19 started, the whole world used slow soap and other things, and there is no such proper water sanitation in Pakistan. In my district, Maldan, the water is already contaminated, and one of the university professors told me that the residents are affected due to the same in Maldan. So what can you say regarding water contamination, and are there any peculiar insights that can be of relevance to these journalists?
Yeah, I mean, it's hard to say what might be the issues there, and what the solutions could be, but there's, this is where the hydrogeological studies come in, to help sort of figure out, maybe the best solution is in a different groundwater source, and figuring out how to finance and mobilize around that solution. It's, if there are places that are offering clean water without that contamination, figuring out maybe how to expand that to larger areas. It's really hard for me to comment on that without knowing the specifics of the situation. But I always believe when there's a will, there's a way, and just keep at that problem, keep shining a spotlight at that problem until that community has safe water.
So Zara, what's still on this issue of water contamination? There is an initial problem of people having access to water. There are some places that water is not even available at all. Then we also have cases where contamination is really an issue, in which the water that is available is not even safe for the people. Now, so how does the issue of water contamination, how does it play? What role, or how are you considering it at organization? And what are you doing about it holistically, specifically, or even broadly for people in communities that are affected?
Yeah, absolutely. So when water.org introduces our solution into those local communities, we want to make sure that the water being provided to them is safe water, right? We don't want to be providing them more dangerous water than what they may have already had access to. So our number one priority is making sure that they have a safe connection. And that really also ties back into having safe water sources. So you don't want to be drinking from, you know, a lake that has contaminants, you know, flowing into it from a local factory or anything like that. A lot of our partners do offer filtration systems as a product that they can finance. So in Indonesia, we've seen a lot of instances of people that may have water access, but they don't think that the water is safe. So they're able to finance a water filtration system for their household. And they've seen that their water quality has greatly benefited from that filtration. Again, because we can't monitor where the water is coming from, we can only do our best to ensure that the local partners are able to direct their customers and their borrowers to those safe water sources. You know, that's really our on the ground help, our eyes and ears of what the water situation is like. Thankfully, we have not had very many instances of hearing from our borrowers that the water that's being supplied to them is dangerous. Specifically in Bangladesh, where the issue of arsenic in groundwater is very prevalent, we've worked with our local partners to develop technologies that can circumvent that issues. So they have like deeper tube wells that go deeper into the ground to bypass those arsenic contaminated groundwater tables. So there are certain unique solutions in those geographies that we're able to tap into. But again, like Heather said, it's all dependent on local context and what the local issue is.
Then I'm really happy you went deep into how you practical cases of how societies can deal with water contamination. And which was the issue of the environment. And I think I read in one of the organization's publications and even the UNDP that climate change also poses a major challenge to water security. And but in places, so let's for a minute talk about climate change and water crisis. Specifically, for journalists that really want to cover the interconnection between climate change and water crisis, what do you think are the issues that they should be thinking about? And to provide, can you please provide more insight on reporting climate change and water crisis?
Yeah, I can take that one. So we have both the adaptation and the resiliency space of climate change as well as the mitigation side. So first I'll talk about the resiliency side. So through work like water credit and it being a sustainable system, one thing that is successful, I think, about the model in terms of how we can be more resilient with climate change is that the households are able to make decisions that make sense for their local environment. So for example, if they're in a flood prone area, they're able to get loan for a toilet that's off the ground, so it doesn't get flooded as easily. If they do have a climate shock from weather, storm, droughts, whatever that destroys their water sanitation infrastructure or makes it unusable, then they can tap back into that. Sorry, I went on mute. So they can tap back into that same microfinance system and get another loan to make those repairs. So it does help from that resiliency perspective of being able to choose appropriate solutions for the climate and being able to rebound when there is climate change. We are learning more and more about this every day. We've just started to include very climate specific questions into our research so that we can understand more about what's happening. From the mitigation perspective, one thing we haven't talked about too much today is that we do partner with utilities and water and sanitation service providers. From there, we see the greatest opportunities of being able to connect financing to those service providers to do things like make repairs to leaky pipes, because the energy to treat and move water is fairly significant. And so being able to to reduce, sometimes there's 40–50% of water that gets lost through leaky pipes, which hurts the pocketbooks of the service providers that are often barely just trying to survive, but then also waste a lot of energy. And so there are aspects that can be taken from fixing leaky pipes, for example, that can save carbon going into the environment.
Yeah, so we still have a lot of questions, and I would take two important ones, one from India and the other from Uganda. So Hussein in India is asking, let me read the whole question. So I think the context and the background is they are quite important in this question. So in India, about 6 million people are facing acute unavailability of water. And in this ongoing pandemic, there is a recommendation from government and WHO as well to wash your hands with soap and water frequently. Tap water or access to safe drinking water is still unaffordable for many in India. So the question is this: how can poor people manage to follow this recommendation with absence of water? I think
that is a tough question, because you're right. Without having that safe water at home, how are you going to wash those hands? If those individuals, if those households are not able to access a water and sanitation loan from a local microfinance organization, they will have to access community water sources and just lean on each other for support. What water.org really wants to be able to do is empower those people to be able to go to their local microfinance organizations and take out a loan so that they can finance their own solution at home. For a lot of those people, it may not be possible to be able to take out that loan. And so those are where those government funded solutions do come into play. But really, we believe that the best solution is for them to be able to finance their own household solutions.
Does Heather want to add anything to what Zara just said?
I just agree that I agree that's a tricky question. It's very challenging. And so, that's one reason we're doing water credit, is we're trying to accelerate the pace of people being able to get access to water in their households, so that they can wash those hands. It's something, that's what we're fighting for.
Okay, now let me ask before I ask this question from Omeo from Uganda, what is your current involvement in Africa? What practical involvement does water.org has in Africa? Zara?
Go ahead, Zara.
Whoever's ready can.
Okay, I'll start off, and Heather, you can continue. We do have operational presence in East Africa. Currently, we're in Ethiopia, Tanzania, and Uganda. So we are currently working with water credit in those three countries. In the future, we do hope to scale up our presence in Africa. But again, like Heather said about the Nigeria question, it's all a matter of resources. We've seen a lot of potential for water credit in at least those three markets that we're currently in. So we're very pleased with how water credit is performing there. You always hear that Africa as a continent has the greatest need for water and sanitation. And so we do want to focus our efforts there, especially as additional resources become available to us. But currently we are in Kenya, Tanzania, Uganda. Heather?
Heather?
I guess a little bit more to what Zara said. We could take Uganda, for example. And one thing that's also really great about microfinance and financing is it's going to evolve based on the local context. And so in Uganda, it's been exciting to see that we've had more loans go to institutions like schools or clinics. And there's these institutions that are taking out loans so that they can get water to schools, water to clinics, entrepreneurs that are able to provide water services. And so that's a form of the model that's really, we've seen quite a bit of success in Uganda compared to other countries.
Oh, yes. So I'm really glad that you mentioned this because the question is all around local partnerships in ensuring that, yes. So the person asked, it's okay if you can't mention the specific names, but are there some CBOs in Uganda you partner with, contribute grants and donations to effect these interesting projects and the campaigns?
Again, we can give you the partner list of all of our countries. I'll send them to you, Paul, so that you can disseminate them. That would be great.
Okay. Okay, that's okay. Then so that we can still talk about it. So what do you think the role of local partners in water credit in ensuring access to good water is beyond just the official announcement of partnerships? So what are the direct responsibilities, and are these direct responsibilities impressively being delivered by your local partners across the world?
Yeah, I'm glad that question was asked, because it's something I've been wanting to get out there. One important, well, I guess a couple of things. One of the things that we initially do before working with the partner is we go through a due diligence partner certification process to ensure that they are sound organizations, but that also they have good practices and client protection policies in place. And so we do a lot of due diligence before we start to work with them. And then when we start to work with the organizations, one of the initial things they do is market research to understand, what is the water and sanitation environment like in their area. What is the consumer demand for water and sanitation loans? How much can they pay? How much can they, what terms would they need to be able to make affordable payments back over time? So they do all of this research to sort of put together products that work for the communities that they're serving.
Okay, so Zara, I don't think I can take because they're already running out of time. But really, as we I'm trying to put everything together now. So for Zara, what do you think is the quickest and fastest way to achieve these UN Goal 6? And what is still missing in ensuring that everything that needs to be done, that needs to be present, is still together towards these lofty and I would say ambitious developmental goals?
Yeah, great question. So to tie it all together, I think there's still a lot of work to do in bringing safe water and sanitation to people around the world. I think what's still missing is maybe that local government buy-in. As we mentioned, financing is the largest challenge in making sure that everyone has access to safe water and sanitation. A lot of our work in the sector engagement arena has been around engaging with those local governments to ensure that they understand that financing is a large issue and that they should be putting their policy focus and some of their budgetary lines towards water and sanitation. We've seen some success in this in certain countries. I think Ethiopia was a country where we saw some language around water and sanitation financing enter some of their policies. We've seen some successes in India and some of these policies as well. I think that's probably the number one issue, is bringing that awareness to those players that can make these changes happen in their countries. And again, with our local partners, I think making them aware that financing is a large barrier and that they also have a role to play in unlocking that capital for those people at in their communities that need the financing. I think those are probably the key areas of awareness building that we could use the journalists' help in reaching.
Yeah, and I'm glad to really tell that journalists are always ready to assist in whichever way they can to make these courses to achieve the set goals. So we are we've run out of time, and I really want to take this opportunity to thank Heather and Zara for joining us today and for sharing insights into the peculiar world of water reporting. And for everybody that is on this session, I really want to thank you for joining us today, and I hope this webinar helps inform you better on the subject of of the day, and more importantly, helps inspire potential new angles for stories. So if you are not a member of the ICFJ Global Health Crisis Reporting Forum yet, I encourage you to please find the group on Facebook, or for more information about the forum, go to www.icfj.org. And if you would like to access journalism resources on COVID-19, please check out the International Journalist Network at www.ijnet.org. Please don't forget to fill out a survey coming to your inbox after this webinar. ICFJ would love your feedback to improve programming for this series. So thank you, sir, Heather. Thank you. Really appreciate you. I hope you also had fun on this webinar.
We did have fun. Thank you very much, Paul. Thank you. Thanks, everyone.
Thank you.
Yeah, thank you, Zara. So thank you, everybody. We are going to see you again same time next week when we'll be discussing another exciting and interesting topic. Have a lovely day. So we are out in 5, 4, 3, 2, and 1. So have a lovely day, everyone. Bye.